Hello everyone, welcome to Raaonline. I'm Dr. Abhinaya. I'm a consultant pediatrician. So in Nelson-based pediatric teaching, in the chapter discussion of neurology, the next topic of discussion is on autoimmune encephalitis. So it's a very new entity under the neurology, and you'll be able to identify when you should suspect autoimmune encephalitis and how it is different. The presentation is different in children and presentation is different in the adults, and what are the antibodies that you have to see and how are you going to manage it. And very interestingly, it is very close to the presentation of an infectious encephalitis, but with a certain subtle clinical features and some neuroradiological features. You will be able to differentiate both, and of course the treatment is going to be so different from the infectious encephalitis. And we have to be very careful in identifying this condition, and it responds excellently to the treatment. Okay, so let's get started. So this autoimmune encephalitis is now being increasingly recognized as a significant and a frequent cause of encephalopathy in the pediatric age group also, right? And as the name suggests, it is autoimmune encephalitis, but not all the children do have the antibodies detected in their serum. So around 66 to 70% maximum they have these antibodies, but most often it is a seronegative autoimmune encephalitis. So, but even if it is seronegative, how do we label as autoimmune? Based on the clinical presentation and based on the neuroimaging finding. Most common antibody which is associated with autoimmune encephalitis will be the anti-NMDA receptor antibody. Okay, so this you have to remember. Unlike the adult autoimmune encephalitis, association with cancer, that is, it is most often in adults, it is a paraneoplastic condition. A woman with a ovarian teratoma develops a encephalopathy, then you have to suspect that it is a paraneoplastic condition. But in children, the association with cancer is less frequent. Okay, so this is going to be an introduction. You need not get confused. Okay, so I'm just telling an introduction for this condition. We'll talk about all these. So what are the cancers that are associated with autoimmune encephalitis? We'll talk about all this in detail. It has a very good neurocognitive outcome when diagnosed early and when the treatment is initiated early. Okay, so pediatricians definitely have to be aware of that such a condition exists. So autoimmune encephalitis, basically these antibodies target the synaptic receptor and the synaptic proteins. So it is a disorder of memory, cognition and behavior mostly. So the children, they behave, they get encephalopathic, but they behave very erratically, their memory is gone, their cognition is gone, and their behavior is very different. That is noticed by the parents. And seizures, of course, seizures and the movement disorders are also seen in children. They don't have any other systemic manifestations. I told you in children it is not often associated with cancers. Okay, so there are no systemic manifestations. It is a very serious condition, but yet treatable condition when detected early and treated early. So this is how people were perceiving autoimmune encephalitis previously. So when a previously well child, now the child behaves very erratically, is shouting, his or her cognition is disturbed, the behavior, all those movement disorders like very violent swinging of the limbs, flailing, and so all this violent behavior was believed to be a demonic possession.